We expecting Bradon?
Yeah, we are.
Okay.
Good morning.
Good morning. How are you?
Doing well. Sorry this took so long to set up. It was a busy week.
It's all good. I wanted to open just with, it's not lost on me that you guys are very busy right now. So I just wanted to express my appreciation that you can make time for doing this, and thanks for being here. I wanted to start first with just getting the temperature of the room and ask you guys how you guys are feeling generally about where Moab is, where Grand County is right now with respect to the pandemic. Are we doing all right? We doing bad?
I think we're doing really well, and a lot of that comes from the understanding that people have taken the recommendations that we've made very seriously, and they are making an effort in the community to follow the social distancing guidelines. And more, I think businesses are understanding that whenever we get to a point of reopening, it's going to be a gradual process. And each one of those businesses recognizes that they don't want to be the center of disease transmission. So they'll all need to put plans in place to mitigate risk. And now that's a little while down the road, but the fact that the messages that we are starting to receive reflect that concept is a very good thing. Orion, what's your thought?
Yeah, I think that we've done amazingly well, and I would like to emphasize that it's not just us as the health department doing amazingly well, it's our community doing amazingly well. We've received an outpouring of support in what we've done, even from those businesses that have been, frankly, hurt by the decisions that we've had to make. But I've also been very, I'm very impressed with our business community as well as our just general citizens and how seriously they've taken this. Like there's only so many businesses that we actually have jurisdiction regulation over. All of those have taken it well, followed our guidelines, partnered with us. But we're seeing businesses that there were no restrictions placed on taking these measures to help protect our community as well. Like, we have gear shops that have closed that have blocked off their front doors, and they're doing counter service essentially, and providing hand wash stations and that sort of thing. And I think that's really powerful, because from the beginning we've said that the most powerful tool that we have is the individual taking on the responsibility of the social distancing and leading by example, because of it can't just be us as health officials. We need the buy-in of the community, and I really feel like we've gotten that. One
other element that I think puts us in a much better place than we would have anticipated maybe a month ago is that now, though you can't ever be 100% sure with projections, it doesn't look like the hospital system in Utah is going to be overwhelmed. And how that helps us is knowing the limited size and capacity of Moab Regional Hospital, and they've done an amazing job of looking at how they can expand their services. But if it were necessary to take someone somewhere, a month ago we didn't think there would be any place to take them, and now it looks like that's a possibility.
Yeah, so that gets into my next question, which is kind of how independently is Moab's success from other communities' success? You're talking about how Utah being in a good position is also good for Moab. I mean, how does the position of the whole United States on the COVID-19 curve of the world, how does that impact Moab in particular?
I think Moab, Grand County, needs to take credit for essentially being where they are now. We've had the one case, and that person did exactly what they needed to do. Ryan mentioned people being responsible for their own decisions, and yet Moab is one of the most unique places in the world in the fact that it maintains a rural feel and is an international destination. And so it will always be tied to what's happening regionally, nationally, and worldwide. And that is a consideration as we look toward the future. We're doing great now. How do the trends in Colorado and in back east, how will they affect us moving forward? That's hard to answer right now.
Yeah, so as we're obviously at a point now where we have to consider what reintegration of visitation looks like. And one of the key points of that is we need to know what's going on in our local, regional, national, international, global situation of what's happening, and make those determinations for what bringing businesses back to some open in some capacity is going to look like. And that's why we as the health officials are looking at transmission rates all over, as well as asking the important part now is asking our business community and each of the individual types of industries how they think that they can mitigate the risks of exposure in their particular types of business. And we've begun that as of today with salons and body art and massage therapists and that sort of thing, because we recognize that they're pretty much serving our local community, and that it doesn't appear that there's significant disease in our community. Therefore, it allows us to be able to ask those industries how can they do it safely. And we have a form online now where people can submit their mitigation plans to us. We have a team set up that is reviewing those plans. And those plans are not just a way for them to tell us how they can do it. It's a way for us to collect data on, parts of industry that we don't necessarily understand. We have our areas of expertise, but those business owners are experts in their business, and we need that input, and we need to understand stuff that they're coming up with. Because I've spoken with several and been kind of surprised about where they see issues arising and where they are brainstorming ways to mitigate those issues.
So my next question is, Moab has had one case so far, and that, as you mentioned, the person is recovered. And so, right now we don't have any active cases of COVID-19. So the question is kind of about whether we're already possibly past our peak. For individuals, when you go into self-quarantine because you know that you've had contact with somebody who has COVID-19, the typical timeline for being in quarantine, self-quarantine, is 2 weeks. And, it's been well over 2 weeks since we've essentially closed town, and also since I believe the first case has happened. So, are we past our peak? Is that kind of it for COVID-19 in Moab?
We would love to be able to say that, but we don't know. The likelihood is that we haven't had the spread of disease through the community that would put us past our peak. But it's really hard to know right now when we can't test people's blood to see if they've developed antibodies that would indicate exposure at some point recently. Those tests are being developed, and there's a lot that don't work very well. And so the federal government is trying to identify those antibody tests that give us some degree of confidence that this is actually the right result. I think what we do know, though, is that we've learned so much that even moving forward with potentially integrating visitors, by controlling those interactions better than we would have a month ago, we can still keep our whatever peak we have flatter than the early projections would have indicated.
Yeah, I would say that there's no question we've significantly flattened that curve, and been able, and by limiting those visitors, not only were we flattening the curve, as it were, but we've also been able to, we bought time for the hospital and other emergency services to raise that bar higher of their capability to respond. Therefore, we're better prepared at this point to mitigate anybody if we do see an increase of COVID-19 as reintegration of visitors occurs. We're better prepared to respond. And I think that's a really important part of this. Like, we weren't prepared a month ago. We're far more prepared now. And yeah.
Given the path that the world and the United States is taking, that will certainly have an impact on whether Moab can safely reopen to areas of the United States and of the world that are still being impacted by COVID-19 come fall or whatever. So what is your view on how realistic it is that tourism can pick back up, even if maybe only a little bit, come summer or fall, winter of 2020?
That's a question that is on everyone's mind. I want to go back to the idea I mentioned of controlling the interactions we have. Orion talked about salons, right? Even now, there's a little bit of risk in that client and employee interaction, but we feel like it can be controlled a lot better than it would have been controlled a month ago. That is the same idea that I'd like to emphasize moving forward for Grand County in tourism. What tourism can be controlled, maybe not actually the right word, but managed in a way that we don't have lots of random interactions where people get put at risk in large groups. So the type of, I think tourism, in fact, tourism will come back to Grand County, but it will be done in a different way than usual. I think we'll really have to, unfortunately, pay attention to those events that draw huge amounts of people. Those, though we can't know for sure what will happen, I think those are kind of hot button types of events right now that could still spread a lot of disease, but where we can ensure that interaction will be done in more small groups, even though there's more people there, that's where tourism is possible. And I recognize there are some choke points. You know, we talk about food delivery, food purchasing. There are certain points that everybody gathers at, and we'll have to really pay attention to those issues and figure out how to mitigate those. But tourism will come back to Grand County.
Right. And so I think it's important to state too that it's not just us, the health department, that's looking at what the reintegration of visitors is going to look like. We're partnering with the Chamber of Commerce. We're partnering with the community and economic development, with the county, as well as the Travel Council, and coming up with and getting their buy-in, their support, their expertise in how we can go about this safely, slowly, and ease back into tourism. So I think it's very reasonable to expect that we see some level of tourism in 2020. What that looks like, we don't know yet. The figuring it out is, putting this plan together is still very much so in its infancy. But the discussions are happening, and we're doing our best to have as solid of a conversation with everybody as necessary. And of course, we're going to bring business in on that as well, to help to understand exactly how to do this. But what it looks like for sure, we don't know.
Yeah. I'm looking at the time, so we'll have this be the last question, but I'm not going to ask you to do fortune telling, but people are very interested in what the next month or weeks or even days will look like. And so my question is essentially, Moab has had a positive testing rate of 1 in, however many tests we've done. I think it's like over 200 at this point. Wrong. Grand County has gotten back 148 tests as of today. One of those has been positive, and one of them has been inconclusive. That's really low compared to the rest of the state and the rest of the United States. How realistic is it, especially if we do start reopening tourism in a sort of controlled or managed way? How realistic is it that Moab can continue this path of having very low positive testing rates, which of course is a good thing, and of not overwhelming our hospital? How realistic is it that we can continue to do that over the next few months?
I'm looking for my crystal ball. So I do think we can do a very good job of not overwhelming the hospital. Part of that is due to some of the plans that they've implemented, and a lot of it is due to the public's understanding of how to protect themselves, how to protect others. Just those things will result in a flatter curve than we would have gotten 4 or 5 weeks ago. I don't think we'll continue on at the rate of 1 in 200, so to speak, positives. I do think we will see more positives. One of the factors that works in favor for Grand County is a healthy population. That doesn't mean we don't have people at risk. We do have people that are at risk, and we have to continue to keep those people particularly in mind. How do we manage their interactions? How do we, they don't want to be shut in their house for the next 6 months either. They need some interaction. And yet we do know for at least a little while, we still need them to really pay attention to their social interactions. So I think we'll get more positives, but you hate to make a real prediction. I guess I could say we'll get more positives, but I think we flattened the curve. I'm sorry, kind of really stumbled through that part, but Ryan, what do you have to add there?
I think that there's pretty much no question that we will. I think the important takeaway with it is that, yes, we will see more positives. It would be very bizarre if we did not, with integrating people from the outside. Well, and to clarify, by outside, we're going to focus on people within close driving distance. That's one of the things that we're going to work on with the Travel Council, is focus on advertising to those groups that are not in a hot spot, that are easy driving distance, and we have a better understanding of transmission rate. That's another mitigation technique. So will we see more positives? Very likely. Are we better prepared to deal with those? Yes.
Gotcha. All right. Those are all the questions I had prepared. I, as always, want to leave it open to let you have the final word. Is there anything that you want to emphasize or add to what we've already talked about?
One thing that I've wanted to address for a while, there's this conversation that's happening in parts of our community that these decisions are being made by outsiders, people that aren't from here. And something that people don't, and something I want people to know about me, is I'm born and bred Grand County. Like, my great-great-grandfather's father immigrated here in 1890 and built Start Hall. Like, I'm about as from Moab as it gets. And I'm not an outsider. I'm trying to help make these decisions for our community, to protect our community, because this is my community. This affects my friends, families, neighbors, like everybody. Like, I see what's happening with the side effects, and those side effects hurt, and I recognize that.
It's a real poignant thought from Orion, and just echo that. I don't live in Grand County. I live in Carbon County. But what we've done, initially on, I felt, we were really in a no-win situation. If we didn't do anything and had a lot of disease, then we failed. If we did something and caused economic devastation, that seems like a sort of failure, even though you're protecting people and keeping them alive, which is really ultimately our responsibility. But and that weighs heavy on each one of us every day. I do want to say that moving forward, as Orion mentioned, the solutions to this, while the health department is a part of the solution, but it's going to be driven by the community, and we'll all have been changed by this, and we'll all see our behavior a little bit differently over the next several months. We'll see more masks in public. We'll see people washing their hands, and those are good things for now. And it will be that community level approach that really helps our hospital, helps our first responders, and helps our neighbors. And that's really the most important part of it.
All right. I appreciate you guys' time. Good luck on controlling this virus.
Thank you, Carter.
Thanks.